Welcome everyone. Thank you for joining us for today's webinar. My name is Ardian Berisha and I will be your organizer for this webinar. Today we are presenting one of the most discussed topics in occupational health and safety, Introduction to Hazardous Material, Worker Health, Housekeeping and Hygiene. Our presenter for today is a senior consultant, trainer and coach in occupational health and safety and also a PCB certified trainer, Mr. Raza Shah. Before we get started, I'd like to go over some technical points so you will know how to participate in today's event. We highly recommend this presentation to be as interactive as possible, so you will have the opportunity to submit written questions to today's presenter by typing your questions into the question pane of the control panel. You may send your questions at any time during the presentations, as we will collect and address them during the Q&A session at the end of today's presentation. You can also use the raise hand function as well, which means that we will unmute you and you will have the chance to ask the question directly to our presenter. Now, without further ado, we will turn over to Mr. Shah. Mr. Shah, please, you may start your presentation.
Thank you very much. I am Raza Shah from Pakistan, and I am lead editor for ISO 9000 for ISO 14000 Shahs, and I am advanced editor for SA 8000. And today the topic we are going to discuss is a health and safety related topic, and it is introduction. Basically these are three topics and we have merged these three topics, and these are introduction to hazardous material, worker health and housekeeping and hygiene. These three aspects have very great impact on the performance and productivity and goodwill of the organization. So we must be aware of these concepts, and we will learn today what are the requirements, what are these concepts and what are their requirements, and during audits what type of NCRs the auditor normally raise. I am going to start the first concept, which is hazardous material. Hazardous material is anything which may cause risk to health, property or environment, and many organizations use some hazardous material, but they must use these material in a safe manner. So by using these materials, there should be no any dangers to their workers and to their property and their business reputation. And if there is any problem, it will be dangerous for their workers, for their business reputation, and they will also be violating the legal laws. So any business should be aware about the hazardous materials, and they have to manage how can reduce the risk and make sure that usage of these hazardous materials are in a way that it is not very much dangerous to the user or to the business or to the surroundings. So if somewhere these materials are used, the organization should the potential of the risk associated with such materials, and the organization should use the personal protective equipment, so like goggles, like respirators, like gloves, like masks. So the impact of these hazardous materials cannot harm the life of the worker or user. And for precautionary measurement for each hazardous material, the organization should develop and use the material safety data sheet, so the user can be well aware that how these materials can have a negative impact to him or to the surrounding, and what precautionary measurements the user should take care while using these materials. So to reduce the accident, and we must be aware how these materials can be handled, and we should also take the precautionary measurements to avoid any accident. So if a company is taking care and of handling the hazardous material, it will be beneficial for this organization, beneficial in the way that less time and money will be lost due to injury or accident, and decrease in cost due to spill or poor handling, and improper shortage of storage or disposal of chemical. So if an organization is implementing the hazardous material control, it will definitely save its time, its money, and definitely there is low chances of loss. And at the same time, it will be avoiding any property loss or during the handling, storage, or disposition of such materials, and it will also be not very risky for the reputation of the business. And if a company is taking care of the hazardous material handling, it is taking care of the environment also. So the different standards, international standards, are also focusing on the handling and management of the hazardous materials, like the ETI is stating that it is the responsibility of the organization that a safe and hygienic working environment shall be provided, bearing in mind the prevailing knowledge of the industry and of the specific hazards. Adequate steps should be taken to prevent accident and injury to health arising out of associated with or occurring process of work by minimizing so far as is reasonably practicable causes of hazards inherent in the working environment. So it is required that the hazardous material should be carefully handled and managed, that it may not affect the user or the surroundings. There are also some ILO conventions which are focusing on the hazardous materials, and first one is the workman compensation. This ILO convention state that there must be a list of occupational diseases and toxic substances associated with them. So for each trade, the list of occupational diseases and toxic substances should be declared or defined. And the second ILO convention is Occupational Safety and Hygiene Convention 1981, requires employer to ensure that so far as reasonably practicable chemical, physical and biological substances and against under their control are without risk to health when the appropriate measures of the protection are taken. And the next is the Chemical Convention 1990 requires employer to ensure that all the chemical used to work are labeled and that chemical safety data sheet have been provided. And the next one is the Prevention of Major Industrial Accident Convention 1993. And all this, the focus of all this convention is that the hazardous material should be taken, handled or managed in a careful way, that they should not be destroy or damage the health or life of any worker or property or the surrounding. The other standard, which is the very popular standard, is occupational health and safety, and it is also focusing on the hazardous material control, and it is stating the clause 4.3.1 is stating that identification risk, assessment and determining control, the organization shall establish, implement and maintain a procedure for the ongoing hazard identification, risk assessment and determination of the necessary control. And 4.4.6 of this standards also is related to the operational control. The organization shall determine these particulars, these operations and activities that are associated with the identification hazards, where the implementation of control is necessary to manage the occupational health and safety risk. So, if there is any hazardous material, the organization should identify it and introduce some control to minimize the risk associated with this hazardous material. So, the organization must eliminate the hazards or risk. If there is any, the organization is using any hazardous material, it should eliminate the risk associated with this hazardous material, and it should also introduce some control to reduce or minimize the risk associated with such hazardous materials. So, and if after this control, if there is some residual risk, it should take the corrective and preventive action, and should use the appropriate personal protective equipment so that the user can be safe while using these hazardous chemicals. Another standard which is very popular in Europe is the REACH. It is also focusing on the handling and management of hazardous material, and there are some other recommendations from ILO, and these are the benzene recommendation 1971, occupational cancer recommendations, and list of occupational diseases recommendations. So all the focus of all these recommendations is the hazardous material management and control. If you see the cycle, it is starting from assessing hazardous material risk, and then you need to design physical and procedural control, and after designing the control, you have to train workers and managers, and then implement control, and after implementing the controls, implement emergency response procedures and monitor controls for effectiveness and improve controls as needed. Inventory all hazardous material. So this is a continuous cycle, and you have to take care of all the steps, and you have to take care of all the requirements to develop an effective hazardous material management. These are some non-conformities which are raised during the audit, And the first one is the young worker handling chemical. In some organization, the underage or young workers, the worker below the 18 year of age is handling the chemical. And the next one is the failure to provide the required medical exam. The next one is the failure to provide the required medical exam. So the workers are not undergoing the medical test regularly. Chemicals containers unlabeled or labeled in a language worker do not understand. Some containers which are containing the chemicals are not properly labeled or labeled in a language which is not understandable by the workers. Maybe these are labeled in English language, but the workers cannot understand the English language. So you have to label these containers in a language which are understandable by the workers. Workers failing to use the needed PPE. In some organizations, the workers are not using the required personal protective equipment. Maybe these are not available, or maybe the workers are not feeling that the use of PPE is the necessity. No chemical hazardous material certificate for the local government. In some organization, the companies are not getting the required or legal certificate for the usage of any hazardous chemical or material. Government fines for improper disposal, and in some organization, the organization is disposing of the hazardous material which is not allowed by the government, and government may impose a fine on this practice. So these are some common non-conformities which we mostly noted during the audits. The next topic is the worker health, and you know that worker is the most important asset of an organization. So the organization should take care of the worker health, and it is not it is not in the benefit of the worker, but also for the benefit of the business. Because if the workers are not healthy or they got ill, the operation of the business cannot be done smoothly. So during the workers are also take different parts in the operations, and they are also handling the hazardous materials. So the worker should be given awareness and training how they protect them, and they must be provided the necessary PPEs, and they must be given the medical facility, and if they feel any illness or suffer any illness, they should be provided with the medical care. And there should be not any type of discrimination in provision of such medical facilities. This medical facility or worker care should be for all the workers, and there should not be any discrimination in this way. So it is in the benefit of the workers and as well as in the benefit of the business if an organization take care of its workers. So there are some benefits for the business: less time and money lost due to the worker's illness. It is common if a worker is not feeling well or he is ill, the company has to lost money and time. So increase workers' satisfaction and company image in the community. If you provide the workers a medical facility, it will give a more satisfaction to the worker, and the company image in this community also get more good reputation. And if a worker is healthy, it will definitely be more productive. So it will also attract the new customers and the new workers that this company is taking care of its workers. There are different standards which are requiring or focusing on the worker health, and the one standard is ETI, Ethical Trade Initiative, and it requires that a safe and hygienic working environment shall be provided, bearing in mind the prevailing knowledge of the industry, and a specific hazard adequate steps shall be taken to prevent accident and injury to health arising out of associated with or occurring in the course of work, by minimizing so far as is reasonably practicable the causes of hazard inherent in the working environment. Workers shall receive regular and recorded health and safety training, and such training shall be reported for new or reassigned workers. So if you see the content of this standard, this clause of the standard, it is focusing that organization should give a proper and working environment to the workers. So and the workers should be get the health and safety training, and these training should be provided repeated after a certain period of time. And if some new workers join the organization, it should also be provided this training. And if an assignment of a worker is changed, the worker should be provided training or according to health and safety according to the new assignment. There are some ILO convention, and first convention is workman compensation, occupational diseases, as we have also discussed that this convention say that diseases, toxic chemicals, and should be defined for each, has been defined for each trade. And the next convention is C7778. It is stating that a young person under 18 years of age shall not be admitted to employment that have been found fit for the work on the. So there should be a person who is underage will not be employed, or he should not be employed in a way, or will be given a difficult or hazardous task. And the next one is a C121, and this is the Employment and Injury Benefit Convention. Requires that employment and injury benefit shall include apprentice in the public and private sector, including cooperative, in respect of the death of the breadwinner, prescribed categories of the beneficiary. And this this is stating that in the case of any accident, the worker will get benefit associated social security and group insurance, and these benefits will be given to the worker according to the position of the worker. And there are also some other international guidelines, and this is protection of the workers, and the next is occupational health service recommendations and occupational health and service recommendations. And so these all are related to the worker health and safety, and it is basically the responsibility of the organization to protect the workers from any accident and provide them a good working environment. There are some common non-compliances we normally note in this area, and first aid kit are not adequately stocked. The company have the first aid kit, equipment or instrument or the items that should be the part of the first aid kit are not available in it. Too few workers are formally trained in the first aid. In some organization, the number of the workers who are trained about the first aid are very few, while the total number of the workers are very large, but the trained people on the first aid are very few. And next is the failure to protect the health of the pregnant workers. It is the responsibility of the organization to protect the pregnant worker or exponent mothers. In some organizations are not taking care of the pregnant worker, and somewhere the medical supplies are also expired. The items of the first aid kit are found expired. Workers are denied the opportunity to leave their post to seek treatment for illness. In some organization, if some worker is not feeling well, he is not allowed to go for the treatment, and he is bound to work even he is feeling ill. And the next is the young workers not provided with the legally required medical exam. In some organization, the young workers have not been gone under the medical examination, and that either they are fit or they are free from any disease. So these are the some common non-conformities we noted during the audits. The last topic is housekeeping and hygiene. To keep the workers healthy and safe, and to maintain the image of the organization, and to maintain the productivity and efficiency, this concept is very necessary to implement, and basically the working place should be safer and should be kept clean and sanitated. So because the workers and are spend a lot of time at their place, and if the workplace is not clean and not well sanitated, the workers, it will have the negative impact on the workers' health. So by housekeeping and workplace hygiene, we mean that every proper sanitated and hygiene facilities are properly cleaned and maintained, and there is availability of the drinking water, and properly sanitated toilets are available, and safe food is available, and there is proper clean and sanitary kitchen and canteen. And work environment, if we will not take care the work environment, it will definitely impact our operations also. So if you have the good housekeeping practices and floors are clean, there will not be slipping, and the exit routes will be clean. In the case of emergency, if there is any block exit, it will be really very dangerous to workers. And so the organization should identify the risk and should maintain a control to eliminate these risks which are related to the housekeeping and hygiene and can impact the health of the workers. These are some benefits related to these concepts, and if you practice this concept and properly maintain your housekeeping and hygiene, definitely the workplace, it will improve the efficiency of your worker, and that there will be very efficient use of time and less time and productivity loss to worker illness. Decrease in workplace accident and associated costs. There will be lesser accidents, and definitely cost associated with the accident will be reduced, and it will also improve the image of the company. And so the previous concept we have discussed, there are also requirements of the other standard, some standard to the worker hygiene, and the first one is the 3.1 of the ETS standard. A safe and hygienic working environment shall be provided, bearing in mind the prevailing knowledge of the industry and any specific hazard. Adequate steps shall be taken to prevent accident and injury to health arising out of associated with or occurring in the control. And the next is the 3.1 access to clean toilet facility and potable water. And if a sanitary facility for food, so it is the responsibility of the organization to provide their worker clean toilet facility and potable water and facility for storage of the food and proper facility for the eating this food. There are some ILO convention on this, and one is the 120 Hygiene, Commerce and Offices Convention require that all premises and equipment of such premises shall be properly maintained and kept clean. So, and next is the C-155 Occupational Safety and Health Convention 1981 requires employers to ensure that so far as is reasonably practicable that the chemical, physical and biological substances and agents under their control are without risk to health when the appropriate measure of protection are taken. So if any chemical or material a company is using, it should be well controlled. And C-161 and Occupational Health and Safety Convention 1984 states that all members must develop a progressive occupational health and workers, including those in the public sector and members of the production cooperative in all branches, activization of the undertaking. And there are some also some other ILO guidelines, and one guideline is ILO R120 Hygiene, Commerce and Offices Recommendation 1964, ILO Occupational and Recommendation 19 regard to water and sanitation is applicable included. So it is the responsibility of the organization to provide the water and properly sanitation arrangement, sanitary facility. There are some common non-compliances we noted during this, and one is the kitchens not sanitated. The second is the dust build up on machines and floors. In some organizations, we that there is dust on floors. Flooring is in some organizations, the floors are slippery. That is unsafe to drink. In some organizations, the drinking water is not tested, or it is not suitable for working. Toilet facilities that are more now stocked with hand soap or toilet paper. In the toilets, in the some organization not hand soap or other toilet paper. So this is about the today presentation. We have just gone through these three concepts. So it is over from me.
Thank you, Mr. Shah, for this great and insightful presentation. Now we will go ahead and take some time to answer some of the questions from the attendees. It looks like we have a few questions. The first question from the attendees is, can you give us some examples from your own experience regarding the non-conformities you mentioned, and what was done to resolve those issues?
Pardon?
The first question is, can you give us some examples from your own experience regarding the non-conformities you mentioned, and what was done to resolve those issues?
Yeah. On the basis of my experience, in the different organizations, we see our first not stocked according to the local law of this country. Even some organization in the some company, we have found the first aid kits, and there are tablets available for different diseases. But law is saying that there should not be any tablet, and without the advice of the doctor, one cannot use the tablet. So this is one. And in some organization, we have seen that there are the availability of the fire extinguishers and other evacuation arrangements, but there is no any type of evacuation drill. So these are the common in different organizations.
Okay, thank you, Mr. Shah. Now the second question is there a workers' health form that an organization can follow?
Yeah. Normally, the different standard required that the organization build a health and safety committee, which is composed of the workers from the different sections, and if there is any health and safety issue, this committee meet and solve this issue. So it is the requirement of almost like SEDEX, like OSHAs, like BSEI, like SA8000, that there should be a health and safety committee, and a senior manager be in charge or responsible of this committee.
Okay, thank you, Mr. Shah, for answering these questions. Kindly be informed that because of the time limitation, the other questions will be answered and sent to you individually by email. Mr. Shah, thank you
Thank
once
you.
again for this great presentation, and thank you everyone for attending today's webinar. I would like to let you know that this
Thank you very much.
webinar will be recorded and posted to our website as well as on your YouTube channel. Once you leave today's webinar, you will receive a survey about the presentation, and we would appreciate it if you would complete it and provide us with your feedback. Also, if you are aware of a topic that you would like to discuss and participants would benefit from, please feel free to write down your suggestions. We would like to inform you that next Friday we will present a topic on managing the need for laboratory competence in the food supply chain. For more information about our next webinar and other news, check our website www.pcb.com. On behalf of PCB and our presenter, thank you for joining us today, and we hope we'll see you in our next webinar on Wednesday.